Good afternoon. Hey, everybody. Thank you for joining again. We know a lot of you guys were with us last Thursday. You heard me describe a real life situation that I had just found out about an hour before that webinar. So I'm so grateful today to have convinced these three people from Child Care Network to join us today. They are dealing with the same things you guys are dealing with. And on top of that, they spend their weekend preparing to share it with you guys and share the experience they've had recently at a school in the Atlanta market, which they'll tell you about what things went well, how they're adapting constantly, and answer your questions and give you their opinion of things that you're dealing with. So thank you to Jamie, David, and Chris. I'm going to introduce David Evans, who is the chairman and CEO at Child Care Network. David will pick it up from here and introduce his team. They'll tell you guys about what they have dealt with in the past week and their strategies to move forward. And then I'll join again and take your questions. So if you guys haven't been with us before, you can hover over the bottom of your screen. There is a question, a Q&A tab. Feel free as we go to go ahead and put your questions there. Our system maxes out at 500 people, so no worries if you try to get other people in. We maxed out pretty quickly over the weekend, and we will make this recording available within the next couple of hours after we finish. So feel free to do that. I'll be on the lookout for your questions. And thank you very much, guys. And David, I appreciate you gathering your team, and I will turn it over to you.
And thank you, Kathy. And let me start by saying thank you to you and the entire team at Hinge for graciously sponsoring this webinar, as all of us in the early child education sector and childcare come together with the nation to conquer the coronavirus. To say that the last 2 weeks, I'd say no one likely on this webinar alive has experienced anything of this magnitude is sadly true. Despite this, I believe all of us will rise to this challenge, and today represents a great opportunity to share our own company's learning and experiences and address many questions I'm sure people have. Let me just take a brief moment to introduce the team from CNI webinar today, who I'm deeply proud of how they've risen to this immense challenge in a very short time. Colleagues, and have been responding to multiple issues every day for what seems like forever, but really has only been a week. Chris Smith, who many of you know, Managing Director and Chief Operating Officer. Chris has been ensuring that all of us, multiple states, consistently respond to the many issues posed by the crisis, and that issues of public health, regulatory, licensing, parent, directors, and teachers are each considered as we seek to keep these in balance across an ever-changing, and I tell you, the team will share with you, more hourly landscape that's changing. He's going to present specific examples and the actions we've taken so far. And Chris has been in extensive communication with our licensing and other regulatory frameworks as we not only seek to navigate the early days of the most significant health crisis in our nation in decades, if not 100 years, but work with governors and other parties to design solutions. Top of mind for us is to preserve first quality ECE and childcare for children and their parents who will need this continuing care critically as they have to work from remote and not so remote locations, and the very real possibility that parents could become sick and unable to care for their children. And as we know, traditional networks like grandparents will be able to do this. Jamie Reckauer, our Vice President, Education and Quality, designated as our lead coordinator to be a single point of focus to marshal the resources of our entire enterprise to respond to this. This week, put in 18-hour days every day, assessing critical issues, including an immune-compromised teacher who tested positive for the virus at one of our Georgia schools, the first in the state and very possibly one of the first in the nation. Formulating key policy recommendations for dealing with this situation, as well as other schools, and most particularly, how to manage the competing tensions of the needs of parent children at this school compared to those of our nearby operations. Another example of Jamie's work is formulating a clear policy statement of how to address requests and requirements for existing and new enrollments to be admitted across our 265 schools in the nation. These are just two of the experiences to share with you today. And Jamie is involved in well more than a dozen issues this past week. You can see by her smile, if you can see her, it's been a lot. And myself, my focus has been on building a coordinated response team and a daily forum across the enterprise, which maximizes communication and gives all of our key team leaders a single point for input, as every day new decisions need to be made in a rapidly changing landscape. In addition, in conjunction with our Chief People Officer, Laura Morgan, strategies and policies how to address the critical needs of our staff, who are the front lines of this battle, affected by the virus, ranging from employment and medical needs, stress management, and delivering enhanced health and safety procedures in our school environment, are amongst the key issues that our entire team has been working on. In a moment, Chris and Jamie will share their experiences with you. But first, let me take a minute to summarize our most fundamental learnings that have emerged from this extraordinary week, which doesn't quite capture it. Probably first and foremost, communication, communication, communication. Creating an environment where your team leaders can all talk together, whether you run one child care center, 20, or 260, is paramount, as there are no right answers, just thoughtful choices on a daily basis. We've done this by integrating the top 10 people into a daily 7:30 a.m. conference call led by Jamie, who circulates a short list of issues and actions that need to be decided each day. Further, when necessary, we have an end of day call if there are things we need to think about overnight. Next, remain calm despite the stress. No decision made out of fear is ever a good one. It sounds basic, but we support one another, have contrasting opinions, and figure out the right compromise solution. It's been unbelievably valuable. Every person has a role and brings an expertise to the table. This, for example, enabled us to make a decision and then in some cases receive parent feedback that was very contrary to that decision, roll it back and move on to the next issue, and Jamie will talk about this as well. And anticipate now, the next important thing, anticipate a rapidly changing landscape that you do not control. This virus is moving at light speed, and what we decide today may need to change in a few days based on events on the ground. Our approach to dealing with this was to assign 2 to 3 person teams across the company to the many possible issues and capabilities we need to draw on, and make sure that those teams need to be ready and thinking about the issues. And Chris will talk about this in a moment, as he's been leading this across the entire organization. And then the thing that I have tried passionately to do is make sure we are taking care of each other. In a crisis, you find out if your team really works together. For the leaders on the call, a vital job for you, and maybe the most important, is to make sure your people know they need to take care of themselves. People who are taking care of themselves are taking care of others even more. In this respect, I am awesomely proud of our team. Yesterday, Tom Wyatt, CEO of KinderCare, many of you know as well, and I spoke for a while. Tom stressed thinking about the critical focus of our child care centers as sanctuaries for our children and the safest place for them to be right now. This is exactly what we need to be thinking about. Tom is a great industry partner as we battle this pandemic together. And finally, Colonel Jack Jacobs, our company's lead director and co-chairman of the Congressional Medal of Honor Recipients Foundation, our country's highest military honor, suggested to me that we all need to think of ourselves, the entire childcare industry, as first responders for our children and parents. And this is how all of our people will find the will to conquer their own fears and serve our nation at this critical time. And that's probably the best advice I've received all week. With those key learning and principles, Chris is going to talk about key school operation issues with some specific examples of the type of actions we have taken as a result of the pandemic. With that, let me turn it over to Chris.
Thanks, David. Good afternoon, everyone. It's great to be able to share with you all the things that have been happening for us, the good, the bad, the ugly. I thought I would start with taking us back a couple of weeks to when things were, somewhat normal. I look back at my calendar, and on February 28th is when we as a group, as a team, began to draft our first correspondence, thinking about this virus. Obviously, 2 weeks ago seems like 10 years ago at this point, but we had drafted just a quick piece to our parents about what we were doing about the virus, and particularly focused on the things I know that all of you are focused on, just the sanitation policies, the hygiene policies, just reinforcing them. And that sort of led into that weekend where I think early that week, March 2nd, March 3rd, we were finalizing those communication pieces. On March 4th, which again wasn't that long ago, Jamie hosted an internal webinar for our staff where we were really, again, re-educating, reinforcing our policies around how to deal with any particular sickness, virus, but particularly as things were escalating, trying to get out in front of what was happening. We did produce hand washing posters that were part of that communication, just getting them in our buildings, making parents aware of how important that was, following the CDC guidelines, as I know everyone on this webinar was doing at the same time. I look back at my calendar that week, and there were still business things going on, right? It wasn't just this. I looked at my calendar, and calls about this and decisions about other things, and then thinking that, well, we had done what we needed to do, and as a consumer, I was beginning to receive various communication pieces from the travel industry and the hotels and all those sorts of things. So felt like we were right there where we needed to be, along with a lot of the other industries responding. I think on March 6th, Friday of that week, David did ask the company to stop traveling, just to try to limit all of our exposures. And so we go into that weekend thinking, the world was still okay, and the timeline that we were on felt right at that point in time. And then March 9th came around, which was literally just one Monday ago, where an email came in to my inbox, not just mine, quite a few folks were on that email, from our division president, Michelle Jones, telling us that we had just received word that we have a teacher, a 3-year-old teacher, with a confirmed case of the coronavirus. The school was in the Atlanta area. I think Kathy mentioned that. There were approximately 90 children in our care in that building. And in fact, there were 27 3-year-olds in this particular or just the Wednesday before, and I know Jamie will fill in some blanks here, but she had gone home the Wednesday before. In fact, I guess now looking back, it was the Wednesday where we were having our webinar, Jamie. That March 4th is when she left, not feeling well, and ended up in the hospital. So, at 12, so that was a 10:11 Eastern time email. At noon, our response team was on a call beginning, to triage what was happening. And to tell you that things were moving fast would be an understatement. That was our first coordinated effort. You've heard David's comments about our team and our communication. That phone call was when we all began to realize, we were on the front lines of dealing with this. And we're going to be making decisions collectively that would impact all of you. We felt like we were in a precedent-setting role, not that we wanted to be. Believe me, we didn't want that responsibility, but we felt like we were there just simply because the cards had been dealt to us. And so we were trying to make decisions for the health and safety of our staff, obviously for the children in the building, our families, but yet we were also conscious of all of you, that we were about to go down a path that everyone would be, and hopefully you won't, but the odds are you probably will have to make some of these decisions as this week plays out, unfortunately. So so the things that I think, as I look back, and even now, even as our morning calls are continuing, there's some key functional areas that you should probably think about. And again, I think David alluded to, maybe our size and scale bigger than some of the people on here, but I don't think that is really relevant. I think these functional areas are still applicable and maybe can be helpful as you think about how to respond in the coming days. So, first of all, we have a response team. That is the team, the core team of decision makers that we are meeting 7:30 every morning, and typically having impromptu emails and side conversations. And then as the daily situation demands, then we might have an afternoon call. So communication is key. I think, communication to multiple constituents. There's the general public, there's government agencies, there's families, there's staff, there's media. So begin to think about the various constituencies that you will be communicating to if and when this virus directly impacts your center. There's the government regulatory agencies. Certainly licensing is key, but unfortunately, and Jamie will talk a little bit about that, you'll be talking to the public health department if you can get them on the phone now, right? There's some challenges there. CDC is important, and even potentially public officials, governors, mayors, it may come to that. The IT component, how you communicate, making sure you have a tool, whether it's just email, whether it's texting, whatever tool you have, make sure it's functional, make sure it's ready, and make sure your contact info list is good. We have found that we had a little bit of stale data, to be honest, to be transparent, and we're trying to fix that even as we're moving forward. The marketing aspect, your website, your social media outlets, how you can use them in this communication effort, you ought to be thinking about. The facility itself, there's so many considerations there. The configuration of the building as enrollment particularly, may be declining. It's certainly declining for us. How you can configure the building, with the public schools closing, can you take more school agers, as maybe the preschool population declines? New enrollments. We were actually talking about new enrollments a week ago. I'm not so sure that's an issue this week as an example of how fast things are moving. Interior facility access. We implemented some procedures just this morning about trying to limit access into the building, and hopefully many of you are doing that and thinking about that as well. Cleaning services. I'm sure the cleaning industry is getting stretched, but thinking about best practices and best ways to continue to keep your facilities clean. There's sales and pricing issues, the tuition aspect of parents. We're getting really bombarded right now with questions about tuition, and we don't have it all figured out, everybody. I mean, we've got a grid that we've started with all these different scenarios, and we're trying to figure out how to price and how to discount. And that is a constantly evolving, moving target. There's the human resources side, and I suspect everybody is curious to how are we dealing with staff and how are we paying them. We've got a similar grid where we've got about 8 or 9 different scenarios of, is there an exposure? Are we closed? Are we open? Is a classroom? All these scenarios and how we're trying to address case by case pay situations for our most important resources, which is our staff out in the field. Procurement issues. We've got a team focused on procurement. I'm sure everybody is getting concerned about cleaning supplies. We are concerned as well. Food for the children and the families. We're trying to deal with that with our largest vendor. And then some of you that may have programs, HS, Head Start, pre-K, classrooms are partners, and how you're communicating with them and making decisions around maybe those particular classrooms. And then last to think about is just education and educational support. We've been thinking, how could we maybe use some digital components to, as maybe families are leaving. I think, that one's probably a little bit down the list right now, frankly, in terms of some of the other things that I just mentioned, but it is on our list. We still are mindful that we're still charged with trying to help families continue the education of their youngest learners. So those are the areas, I hope you can jot those down. We're happy to give those to Kathy, and I'm sure she can be a resource for all of you. She certainly is for us. And so with that, Jamie, I think everybody's tired of me talking and want to hear a little bit more about the trenches and how things have been going. So why don't you jump in and take us through March 9th?
I will. Thank you. Thank you, Chris. Yeah, I think that it's super, super important for us to have that high level conversation and to have some ideas about how we can better organize. But I think that at the same time, I hope will be helpful to just hear the story of how that week unfolded, and hopefully be able to apply some of the experiences that we had and some of the lessons that we learned last week as we move forward into the upcoming weeks and months. And we'll likely have to experience these things in some way, shape, or form again. But to pick up where Chris left off, it was at about noon that on Monday, March 9th, that we started having these conversations internally. What was happening in the background at the same time as we were having those conversations internally is that I was having some conversations externally with our public health agents. And I think that that's really important to mention, that as soon as we got word that there was a possible exposure in our school, the first phone call that I made was to public health. And because there were so few instances in that moment, public health was an incredible guide for us. They gave us a ton of information. They laid out the exact process and criteria and considerations that they had, and helped guide us in so many of the understandings we needed to have in order to make some decisions. Public health is not always going to be that available for us. The volume of cases and concerns that public health is dealing with has grown exponentially as well. And so what we're forced to do is take that guidance that we got from the very beginning and let that be the foundation that we use moving forward, making all of these decisions. So I think one of the first pieces of advice I'd give you is that really remember your experiences and consider them as being benchmarks and foundations for how you move forward. Trust the information that you get in the start, and then consistently act on that information until you have different information, I would guess. But we got in touch with public health. We let them know that we knew of an exposure. They knew as well, which was really reassuring to hear that the healthcare system and public health was communicating with one another. And so immediately, as I got into the conversations with public health and started to understand the scope of what we were dealing with, we did have to make a decision. We had to quickly decide, how are we going to react today on Monday? We have teachers in the building, we have children in the building, we have parents that will be coming in later. We know that we have a confirmed exposure, but we don't know much else. And so as a team, we made a decision to close that school that day. But we made that thoughtfully and cautiously and we decided to close for 2 days. We said, we need some time. We got to figure this out. We need to get more information. We need to understand what our appropriate actions are. And so we made the decision to close for 2 days. And so I think the lesson from that is that nobody is asking you to make a unilateral decision about any circumstance. It's okay to make a gut instinct. It's okay to take a little breath. It's okay to make a decision and then to continue to build upon that, right? So we decided to close for 2 days, and then we got to work. We began organizing what information do we need and what do we have and where do we go. One of the first decisions we made was to disinfect that building. And as simple as it seems, I think that that's really critical to the communication to the community and to your families and to your staff, that we've closed the building, but when you come back to this building, no matter when that is, it's going to be a safe space. You don't have to worry when you come back through the door, because we're going to make sure that we make this space safe for you. Good call there. And then we started working with the health department. So the health department guidance was pretty clear. They gave us the same criteria and all the communication from CDC. We're looking for a direct contact with the host case. So direct contact is 6 feet distance for an interaction of 10 feet or more. And so we decided that that's where we were going to start our flow chart. We were going to figure out who the host was, and then we were going to begin to understand what the relationship with everyone else was to that host that happened to be that teacher. And I think it's important right now to remember that teacher is a person. Like, you know, she's not just a person, she's part of our family. And she has a family and she has loved ones. And so we couldn't get too clinical around this situation, because we're talking about people that we love and talking about people that care for our kids. And so we never wanted to lose sight of the human in the situation. And we never wanted to lose sight of the feelings that everyone was experiencing, our kids, our teachers, our parents. But we worked with the health department to determine kind of who the direct contact was and how we needed to respond appropriately. And under the circumstances, we were able to isolate a group of kids that we knew had direct exposure, and that we knew the guidance suggested that those children self-quarantine for 14 days. And so we knew that those children would need to be excluded from our programming for 14 days. And that's a hard choice to make. It's tough to think about kids being away from you for 2 weeks and what that impact on the family might be, but all the guidance we had in the moment told us that was the very safest thing to do for everyone. And so we and the health notified those families that they would need to be excluded for 14 days. Then we had to look at the staff. And so we had a similar mix for staff and direct contact. And through our interviews, through public health interviews, through our attendance sheets and attendance tracking, we were able to determine that about half the staff had direct contact with that teacher. And so we also immediately knew that we were going to need to exclude 50% of our staff. So one of the lessons I would tell you from that situation is making sure that you've got really solid attendance tracking systems in place that clearly identify when a child arrives in the morning, what classroom they report to. If there are any transitions during the day into other classrooms, be sure that you're documenting that really well. And then documenting when the child leaves at the end of the day. Similarly, I would suggest that you take a look at how you're tracking which teachers are in which classrooms. Because at the end of the day, this became a puzzle that we had to solve. Which teachers were with which kids were directly exposed. And so having all that information is going to really help you solve the puzzle. And then as we move into figuring out how we're going to sustain this over time, look at your operational practices today and ask yourself, really challenge yourself, how can I reduce the number of movements throughout the day? How can I possibly assign a primary caregiver in a classroom and do my best to keep that teacher in that room all day long? And how can I assign a home classroom for a child and do my best to keep that child in that singular room for as many hours of the day as I can. And I know that these are always aspirational goals in early education, but faced with these circumstances, I think we have to start really putting our attention on that task and understanding how we can move the needle a little operationally to slow the flow between classrooms and keep teachers and children together, not only from the perspective of understanding how to mitigate exposure, but also from a social emotional perspective right now. We are all experiencing the stress and trauma. Kids are experiencing it, teachers are experiencing it, families are experiencing it. And the more that we can create just this core unit of support for individuals, I think that we're going to find that that gives us a sense of calm and peace. And so I would really advise you and recommend, based on our experiences, that you take a look at that. A couple other things as we moved through the week, and I guess I've said a lot, and all of this happened in the first 24 hours. So that's another thing that I would let you know, is that getting information, processing information, and making decisions around that information is going to have to happen pretty quickly. So that's why it's so important to have a foundation and to know where you're starting. But in the first 2 days, we were able to determine kind of the levels of exposure and who we might be able to welcome back. And so it was around day 3 that we started making a plan for how we were going to be able to reopen that building, because we knew that our families and our community needed these services. And so we wanted to be able to restore that sanctuary that David talked about for these kids and families, as many of them as we could, as quickly as possible. And we needed to be able to do that in relationship to the staff that we had and to the families that needed that service and were wanting to continue to attend. And so we realized we needed a little bit more time. So we ended up extending our close date for 3 more days, for a total close of 5 days. And in the midst of that, we needed to be able to communicate to families very quickly and to communicate to staff very quickly about those decisions. So to David's point, getting your emergency contact updates, getting a digital communication path, definitely critical. And in this particular scenario, we were able to put together a plan that allowed us to potentially serve some children in our original location. But because of the limited staffing, we realized right away that we would only be able to offer limited hours and possibly a few classrooms in that building. And in fact, we were looking at pre-K and school age in that building. But we knew that we had 0 to 2 families that we still wanted to serve, who still wished to be part of that service. And so as we all do, as I know you do, we start thinking about, where are other options, right? What else can we do? And so we identified that we had space for 0 to 2 and a couple other neighboring schools. And so with all the information that we had, and with our best intention to serve as many kids as we could, and to get these families back into that sanctuary, back into that support network that they were going to need, we made the decision to offer care for our infants and toddlers and 2-year-olds in one of our nearby schools. And we made that announcement at about 5 o'clock in the evening. It took us, those business hours to work that out. And we made that announcement to both sets of parents. We notified our parents at the school that has closed, and we notified the parents at the school that we were offering the space at, to keep everybody aware of what was going on. And throughout that night, we had a tremendous amount of family feedback from the neighboring school. And that feedback went from one end of the spectrum to the other. And in that moment, I think that we were fully faced with the fact that this is a very, very emotional situation that there is a tremendous amount of fear. There's a lot of unknown, and that for every minute that you spend thinking about how you can help your community and serve others and be empathetic and be loving and be supportive of your neighbors, at the same time, you're thinking, what do I need to do to keep my family safe? And what do I need to do to be sure that I am protected? And I really empathize with the position that we put those families at the neighboring school in. And the feedback that we got was that they weren't comfortable, that it didn't feel right to bring kids from that school into this environment that was safe, into this environment that had not been exposed. They were not only worried about their kid, but they were also worried about the strain on the teachers. They were worried about the exposure that might go to the family. And all of this feedback, all of these reactions was real, and it was human, and it was honest. And so we had to respond in a real and human, honest way. And that was to acknowledge that morning, the morning that followed, to acknowledge that we might not have made the right call, and that we needed to immediately dial that back, not only for the families in the closed school, but more importantly, for the families in the neighboring school. We needed to return that fear with reassurance and with affirmation and confirmation. And so we quickly changed course and instead decided, you know what? We will just simply offer care for pre-K and school age where we're able to in that single building, and we'll look for other options and opportunities to support the 0 to 2. And what I think we need to take away from that are two things. One, that our gut instinct is going to tell us something, and then we could get new information and new feedback and new reactions and new responses that change our gut instinct. And as human beings, we need to be responsive to that, whether we are responding to a family or responding to a staff or responding to the media. But also we need to be really gentle with ourselves and realize that we're all in just enormously stressful situations. And it's okay to acknowledge that we made exactly the best decision we could in that moment. And with more information, there's a newer, different, better decision. And we're willing to make that too. We're willing to admit that we got it wrong and fix it, and then move on to the very next decision to be made. So that was a turning point for us. It was a turning point for us in understanding that we needed more stakeholders in the situation. We needed more feedback, that it wasn't just about us, but it was also about constantly staying on top of the way our staff was feeling, the way our families were feeling, the way that the community was feeling. And so they became stakeholders in this big conversation as well, maybe the biggest stakeholders in this big conversation. So even though you may not physically be able to put a parent or a teacher or the community on your team, there should be a voice on your team for those individuals, so that you can keep that information in mind as well. But to wrap this up, we are super thankful that after those 5 days of close and days and days and hours of information gathering and communication, we were able to reopen that school today. And so we reopened that school today for our pre-K kids and our school age kids. And then we will reopen at the end of the 14-day exclusion window on March 4th. And I'm sorry, March 4th, that was like weeks ago, wasn't it? On March 19th, I guess that will be Thursday, March 19th, but we'll open up on March 19th. That's going to be 14 days, that standard exclusion period after the first exposure. And we'll be able to open for all kids and all families and all staff that will be able to return. And so what I take away from that is that there is recovery every step along the way. And so as you're making all of these decisions, don't project as to what that decision is going to result in forever. simply do what you need to do in that moment, and then start forward thinking as to what do I need to do today, and how are each of these decisions leading us back to recovery, leading us back to getting our children and families and our staff back in that safe space so that we can support them as best we can. I think now I'm going to turn it over to Kathy. And Kathy, I think you're going to take it from here.
Yeah, thanks so much, all three of you guys. That was fantastic information, and I'm so respectful of what you guys have been through for the past week. And again, in the midst of all that, to allow me to say, would you do a webinar next week, and then get ready for it. We're so appreciative. We have a lot of really, really good questions. I'm going to group some of the questions around the concept of to close or not to close. And I recognized on my Google News feed this morning how incredibly confusing this is across the country. Is this governor recommends close, this governor says please stay open, this, you know, and so the information and recommendations that are coming out are tremendously different. The first question was, how many companies do we know of that are closing? And David, I know that you touch a lot of the national operators. I'll start by saying I believe that most of the national and large operators are doing everything they can to stay open to serve the needs of families. I am aware of a couple of companies, and 2 or 3 that have made the decision to close for a week or 2, but in the big scheme of things, I'm not hearing that broadly. Do you guys have information to add to that?
Kathy, let me start, and then I'll also have Chris join. So, you know, let me reinforce. I mean, a story I've heard here about Kane County, which is a hot zone for this. When they made that decision, a plumber got up and gave a passionate speech that went viral, where he said, "I need to work so my children can eat." And if you think about extending that to the doctors, the nurses, the people that provide clean water, make sure the power's on for us, all of those people who we serve daily, and I'm sure many of the people here serve on this call serve their children. We are the front lines in making sure those people can feel comfortable about their children are safe and cared for while they battle this pandemic, 1. And then 2, as I thought about this with our team, we've talked about, we could very much have parents who can't care for their children, and we need to have a safe space for those children too. And then in the case of Child Care Network, we know that the hot lunch and hot breakfast we feed children 5 days a week is probably the most nutritious meal they get all week. So putting that in context, Kathy, I think you're right. I think governors are each is trying to do their job. I am very pleased, and I'm going to let Chris talk about in more detail, North Carolina, who certainly has a very evolved, really first-rate child care system that obviously we interact with tremendously, is really trying to take a lead on this and send out some guidance and build some shared understanding. I think I passionately believe, and I know my colleagues on ECEC on the executive board, the other CEO, this country is going to need us caring for children as we, as we try to get through this crisis. And Chris, why don't you talk about what we're hearing in North Carolina?
Yeah, so Kathy, I think to your point, just following a lot of emails, a lot of conversation with some of the larger providers, I think everybody is trying to stay open. The goal, our goal as an organization, I think the industry's goal is to remain open for as long as possible. You know, we in fact today are really focused on encouraging our staff, because really that is the key. You know, as long as we can keep our staff coming to work we have a chance to continue to support the communities. Now, our enrollment is down. I'm sure everybody on this webinar recognizes that enrollment is down. Certainly losing the way they're closing, certainly with the fear that's out there, with every news report being negative, parents are they're making choices, and they have the ability and should make the choice they need to make. I think we're making the choice to be there when they need us, as long as we can be there. I think, to David's point, just in over the weekend, talking and listening and trying to plug in with some of the leading licensing agencies, we're very positive that many of the agencies are with us. They want us to remain open. They want us to be there for as long as we can. You know, certainly there's a governor or two that may decide that if the public schools should close, then the child care centers need to close. We are obviously trying to raise our voice against that. And again, are talking with all the industry leaders. I think there's even a call trying to get organized for David and his colleagues at the highest level, sort of bind together here and try to see this through. It's going to be hard, right? I mean, it's going to be hard. The staff is nervous. They're concerned for their own health. That is the key. We're trying to do everything we can. I'm sure there's tons of questions about how are we paying? What are we doing with staff? We don't have all the answers, everybody. We really don't. All we're trying to do is be thoughtful in every situation. But as long as we're open, we're asking the staff to come, not because of us. It's not because of David, Jamie, and me. It's really because of the families in those communities that are still trying to be productive, and whatever productive is for them, whether it's a show, whether it's whomever it is, to enable them to continue to do what they do to support through this. So, that's our goal. We'll see how it goes. I know everybody is having to make those decisions on their own, but I would encourage us as an industry to stand as long as we can stand.
So you touched a little bit on a second part of that question, is how we communicate to not only teachers and parents, but the general public to stay open when there's so much diverse opinion about, oh, you should definitely close. No, you should never close. What language are you guys using when you address those kinds of questions?
I'll take that
one. I'm going to have you talk in a second. So one of the things Chris and I are doing, Chris is, I think of Chris as EQ skills. So Chris has recorded a video going out to our teachers and directors today, really just having a side chat and saying we're all together. Chris and I are sending out a one-pager tomorrow reinforcing that. Jamie, why don't you pick it up? And I mean, I would encourage that with your people together, or if you have multiple child care centers, getting that out.
Yeah.
The teachers need to know we have your backs. We love you. We treasure everything you're doing right now. And I can't stress the importance of just letting them know that you love them and you are with them in this fight. Take it away, Jamie.
David, I think that you hit the nail on the head there. I think that ECE community has a common mission, and the common mission is to care. And we care about our kids, we care about our parents, we care about our staff. And so this effort to stay open, this effort to keep the lights on and to keep the doors open, is about that innate sense of care and responsibility that we have to all of our community, whether it's so we have to also begin to acknowledge, what does care look like for each person, right? And individualize that, maybe that care language. We're probably all familiar with the 5 love languages, but what is that care language for each individual? Does the mom who's making the decision to not come to school need to be cared for? Yes, she does. We need to honor her decision to do that. But the families that are trying to decide between staying in their workplace, are following the messages around social distancing, we need to understand how to care for that person and to say, we know what you're going through and we know what a tough choice you have. We're here to help you make that choice. And if you need us, here's where we are. And similarly with our staff, we need to know, what are they afraid of? What are their fears? How can we fix that for them? Are they worried about their safety? Are they worried about, their job? Let's figure it out one by one, and remember that our job is to care for them. But if I could just say around closure, I think that there is a procedure and a thought process that you should probably start thinking about right away. Like, what is the benchmark? When does what information is going to help you decide if you stay open or if you stay closed? And we just very recently tried to put together a little, matrix of, when do we close the school? When do we close a classroom? When do we exclude a child? So that we can start looking at this, like where the rubber hits the road, and we don't feel compelled to make this enormous decision to close a school that we might not be able to back out of quickly. So thoughtfully think about that matrix and how you'll make that decision, and be willing to adjust, but at least have an idea.
Great. Two more questions around that. So I think you guys mentioned our staff as first responders. As we treat them as first responders, how do we then ensure their protection, provisions, and pay? And I know there's some things proposed around pay. How are you guys thinking about that? And maybe it's too soon to have answers to it, but how are you thinking about protecting the team as we go through this?
Chris, why don't you take that and tell people what this is a moving issue, Kathy, and Chris is going to give you where we're at today. But Chris, why don't you take that?
Yeah, I enforcing the safety and the cleanliness of these facilities, that they're more likely to be safer in these buildings than where it might otherwise be. I think we today have changed procedures in the building. We're not allowing parents in classrooms. We're trying to figure out even how to not let them in the hallways. You heard Jamie talk about, we're trying to restrict the flow inside the building, that there's a core group of children and there's a teacher, and they are not changing if at all possible. So I think we're trying to do those sorts of things that give the staff, the teaching staff particularly, comfort that we are every hour trying to figure out another way to protect them while they're inside those four walls, or create experience for these children as they can. Do we have it all figured out? Certainly not. I think, we have a matrix. We got electric C's, whatever the plural of that word is. We got a lot of those going these days. One is around pay, around certain circumstances, particularly, is there an exposure? Is the school closed, open? Is the classroom open? Is this, all these variations, and then how we utilize, wellness days, sick days, full pay, pre-K has different rules. So, spreadsheet is getting more and more complicated, but look, we are just making the best decision we can make. I don't think there's no manual here. We're happy to dialogue, but every time we have a call, there's probably another row that gets put on this matrix because there's another scenario that has come up. So we're trying to be thoughtful around the benefit package that it's just commonplace, that's there, but yet also recognizing in this circumstance that we are going to be, as helpful as we can be, as long as we can be, but also certainly for maybe some of the smaller providers on the webinar, the financial strains that create is a real issue too. So, I think you just have to be thoughtful. You have to do what you can do, and there are no wrong answers. Make the best choice you can make based on the resources you have and the data you have at that moment.
Right. And I think
Hey,
we're
Kathy,
hearing, yeah.
Kathy, just real quickly, I think I'd add, just like the firemen and who went in on 9/11 and our military, I think it's important that we all recognize, and the people on this webinar, these are the front line of caring for our nation's children. We have got to get through this pandemic. They are the future of this country. And our teachers are doing that level of work in a time of national crisis that is unparalleled. So I think those are our values. We think about it, but I think we've all got to think about that. But I think inspiring our teachers and recognizing what they're doing is very important.
Good perspective. Thank you. There are a lot of questions around, and I know that, Chris, you said that you guys are have a matrix of decision-making around parent tuition and staff pay in different scenarios. We know that there are proposals to have unemployment kick in immediately for workers and for parents whose children are out of, so there's a lot of proposals going around. What did you guys choose to do? So I'll start by saying, of the schools I know that are closed, and there are very few, like I said, at least that I'm aware of, those have chosen to charge full tuition, at least for the moment, and pay their team full pay. So, of course, there's a big question there with them around how and is that sustainable? How long will families agree to that? Of course, in some schools, that's not an option to charge a parent tuition. So most of these schools that I'm talking to be high demographic markets, but you guys had to make some pretty quick decisions on tuition and staff pay. So you were closed for a week. What did you choose to do in that situation?
Yeah, for that situation, Kathy, we waived tuition for that week when we had an exposed. So we were in the building, right? And so we closed. It wasn't self-quarantine, it was distancing. It was a confirmed case. So we made the choice to close the building, and we made the decision to not charge, or if we had already charged, we were crediting back for future service for that week. Now, again, that was a week, basically specific set of facts that we were dealing with. I'm not suggesting that that works for everybody in every situation. Just keep the parameters around that decision. We had a confirmed case in a room, the Department of Public Health interviewing all of our teachers and also saying other teachers that can't come in for 14 days. We really had no choice but to close the building, and we decided we cannot charge tuition in this circumstance. That a week ago, the way this thing is moving at light speed, would we make that same decision today? I don't know, Kathy, but that was the decision we made a week ago.
Okay.
Hey,
so,
Kath, I'd add to that. I think it's going to be really important tomorrow. The ECECC, including myself, are on a call. We need to come up with a coordinated response. I think particularly for the policymakers on this call, we need to recognize that childcare is perhaps one of the lowest paid, high value professions in America. And many of our teachers are truly of the community, our underserved communities that we serve. And we could really use some help here. We've got to preserve these people. The teachers themselves are vulnerable economically. And to the extent that we can get our regulatory processes and our government leaders to think about this, that would be incredibly valuable right now. These are not people who are living fancy lives. They are the front lines, and they are part of the communities they serve. So
I'm going to expand on that and ask you one more question, because I'm trying to be very respectful of your hour, and you guys have been so gracious. And I know that we have many, many more questions. And just for people to know that have asked questions we haven't gotten to, we will prepare written responses to your questions along with the Child Care Network team, and we will do our best to get you information. Coming later in the week, we hope, we've been offered by a representative of ECEC, which is what I want to expand on, David, to talk to us later in the week when the bill makes its way to the Senate and we see more progress there about what we expect to come out of economic relief. And David, could you just, you're part of ECEC, and I'm not sure that everyone is aware of who they are, what their work is. Could you just tell us who they are, what their general work is, and where they're focused right now? And then we hope to give you more information around that later in the week.
Sure, Kathy, briefly, and Chris and I both, and Jamie, all three of us are actually coincidentally our company's representatives to it. So jump in, team. ECEC is our industry association that is really about quality, safety, creating the highest standards for early child education and care in America, and trying to coordinate us together so that things like uniform standards, best practices can be added, policy at the federal level. We meet in Washington 4 times a year to really try and assess both state level key issues that affect the industry as well as national level. When I joined it, I kind of was like, oh, is this going to be a bunch of bags of wind? It's been 180 degrees in the opposite direction, unbelievably knowledgeable about the industry, the team that we have, and quite frankly, is going to be key in shaping the right answer for the childcare industry and making sure that, I don't think I'm saying anything that anybody will object to in Washington. A lot of things get done, and sometimes they don't get done with the utmost thought. ECE is carrying that water for all of us to make sure that things like, we need to address all childcare teachers in America. We need to stabilize them. We need to be thinking about parents. We need to, an issue. In no way am I advocating for that we should be relieved from negligence, but we're going to be in all of us are going to be in environments every day where we have to make decisions to the best of our judgment. We need to be protected that as long as we use the best standards of care, we made those decisions, and as Jamie and our whole team knows, some of those will turn out to be wrong by definition in a time of crisis. So it's that kind of stuff. Chris or Jamie, you want to add? You guys have the three of us travel regularly to ECEC.
Yeah, I think that's well said, David. The only other thing, Kathy, I would say is the advocacy of this group is very, very important, and certainly, it's advocacy around funding, it's advocacy around standards, the whole universal pre-K pressure we're all sort of feeling is a big theme in this group. But right now in this crisis, the influence, the potential influence that this group has for all the things that we've talked about, particularly around protecting our staff in this crisis, I think, hopeful that this group can be influential, and we're happy to be a part of it.
Right. So several people.
Kathy, please, that these decisions are happening locally as well. So this group really needs to speak up on their position to their local community, to DECAL, to the Division of Child Development in North Carolina, to local state licensing, to local governors. Like the industry, it's okay to speak up and talk about why we're here. It's okay to speak up and talk about how important your mission is to you and your business is to you. So certainly we think of federal advocacy, but these are local decisions and community standards that we're talking about. And so I think everybody should be encouraged to be their own advocate to the community and to their community leaders.
Thank you. Several people are asking us more specifics about ECEC. So Echo Charlie, Echo Charlie. And that stands for Early Care and Education Consortium, correct? And their website is ececonsortium.org. Happy to put that out also in an email. we had 3 of the board members on a panel at our conference and really enjoyed knowing more about the work that they're doing on behalf of the industry. Do you guys have any opinion of what's proposed right now as economic relief, specifically for businesses facing closures because of the virus, or how you expect that to look, or is it too early to tell?
Chris, you want me to take that and then you jump in? Jamie, if you have things to add. I think a couple of critical things. None of us are deeply familiar with how sausage gets made in Congress, but I'm not sure why you would exclude 500 employers and below versus above. We need to stabilize the entire childcare industry, so that would be one. 2 would be, I think we need some reasonable federal standards that protect us from parts of America that might should capitalize on liability decisions made. I mean, I'm not suggesting, I believe this industry has super high standards for quality and the people that at ECEC we work with, but we need to be protected because we're going to have to make real-time decisions every day. So some liability protection would be worth considering here and thinking about that, getting feedback from this group. And then, maybe lastly, some real thought. This crisis could, I'm certainly not trying to alarm anyone, but could go on for several weeks or it could go on for several months. And we need some clarity about a plan to deal with that, whatever the duration of this pandemic is. Chris, Jamie, you want to add anything?
Yeah, I would just quickly add, Kathy, that the executive director of ECEC has been communicating very well around the movement of the legislation, and in fact, I think there is an organized call for the financial officers of the larger organizations to plug into that dialogue and to kind of peel back the legislation as it is right now and to be commenting on that, how it might work. So, I think we're represented well, that we've got, some really smart folks that are looking through this with all of our interest in mind, not just their own. It is an industry interest that's being represented by some of these leading financial officers of the larger providers.
Thanks. I say all the time, it's the spirit of this industry that keeps me only doing this industry for so long. And yesterday morning, Tom Wyatt, the CEO at KinderCare, called me after I sent an email on his Sunday morning. He connected me with someone from ECEC who took a phone call later in the afternoon. You guys were working on a webinar to share with all of these people in the midst of everything you're dealing with. And not one single person I've talked to in the past few weeks has said to me, don't share this with anybody. They have said, use it, help people, share the best practices. And that's just fantastic for the industry. Thank you again so much, David, Jamie, and Chris. This has been fantastic information. And again, greatly appreciate you sharing your time and energy and information. And we'll look forward to hearing more from you. And thank you, guests. We had a 500 guest packed house today, and we appreciate you guys and your attention. We'll let you know as we do more informational webinars later in the week and next. Be safe. Have a good week.
Kathy.
Thanks,
guys.
Kathy.
Bye.
You're the best.
Thanks, everyone.
Bye.